Hello, and welcome to the MGH Patient Care Technician Info Session. In partnership with MGH, JVS Boston will be overseeing this training program to help assess, teach, train, coach, and support all employees who enroll in this program. This is a great opportunity MGH is offering, and we really encourage you to consider taking advantage of this program. Who is JVS Boston? JVS is a nonprofit organization that started in 1938. JVS helps job seekers get new jobs, learn English, and learn new job skills. Last year, we helped 2,000 job seekers get new jobs. So, what is a patient care technician, or PCT, and what do they do? They treat patients with respect and dignity. They recognize and respond to all patient and team needs. They perform EKG and phlebotomy. They measure and record patient vital signs, such as blood pressure, respiration, weight, pulse, blood sugar, intake, and output. They maintain patient privacy and confidentiality. They are a good listener and an effective communicator. They can communicate effectively with patients, nurses, and doctors. They also assist with ADLs, or activities of daily living. Let's talk about those next. ADLs include eating, bathing, grooming, dental care, transferring, walking or moving around, dressing, and toileting. In this training program, you will learn the basics of phlebotomy and EKG. This program does not provide phlebotomy certification, but it prepares you to do the basics required of this role. You will continue to learn more on the job, and like many roles in healthcare, you will have the opportunity to continue growing your skills. If you have any fear of needles, blood, or other bodily fluids, we caution you to consider if this is the right fit for you. You will interact with these sights, sounds, and smells on a daily basis as you work closely with your patients. MGH is a high acuity hospital, which means that many of your patients may have challenging medical conditions that require you to think fast on your feet and help out where you are needed. Is this the right job for you? We are looking for people who are friendly, compassionate, caring, positive, patient, and non-judgmental. You must be able to work rotating weekends and holidays. Shifts will vary and will require you to be flexible, and you will need to work at least 2 of the following shifts: the 8-hour day shift, 7 a.m. to 3:30 p.m., the 12-hour day shift, 7 a.m. to 7 p.m., the 12-hour evening shift, from 11 a.m. to 11 p.m., the 8-hour evening shift, from 3 p.m. to 11:30 p.m., and the 8-hour overnight, 11 p.m. to 7:30 a.m. If you are interested in this training program, you must have a desire to work with adults and children and have a professional attitude. You must have at least an intermediate level of English speaking skills. High to fluent skills are also accepted. You must complete the entire training program and want to work full-time immediately following the completion of the program. You must be open to working 8-hour and 12-hour shifts. You must be able to work some holidays and at least every other weekend. You must work full-time as a PCT at MGH immediately upon completion of the training program. You must have no heavy lifting restrictions, as this is a physically intensive job. And finally, you must have worked at MGH for more than 6 months. If you are accepted into the training program, we will ask you to provide the following documents: a high school diploma, GED, or foreign diploma, a valid passport, employment authorization document, or permanent resident card, a social security card, valid photo ID, such as a Massachusetts ID, driver's license, US passport, or other valid forms of ID, proof of childcare or letters of support if applicable, immunization records, including valid COVID vaccination. The training program runs from June 12th until July 28th. This is a 7-week full-time training program. There is not an option to train part-time. There is no cost for anyone accepted into the program. MGH pays for the training program, materials, and clinical placement for every person in the program. Full-time work as a PCT begins when training ends. You will leave your current unit for your new PCT unit upon completion of training. You must commit to working full-time at MGH as a PCT for at least 1 full year after training with a flexible schedule. This is a breakdown of each week of training. Feel free to pause the video and take a screenshot if you'd like. As you can see, the training takes place in 3 different locations: at the JVS office in downtown Boston, at Quincy College in Quincy, Massachusetts, and at MGH. Once you successfully complete this customized program, there is a full-time benefited job waiting for you at MGH. JVS will be there to support you the entire way, even after you start working. So, what are your next steps? Attend an info session. You've already done that. Next, you will complete simple reading and math activities. More on that in the next slide. You will talk with Andrew at MGH about your placement. You will submit notice of resignation to your current unit immediately upon acceptance into the training program. You will successfully complete the training program. Finally, you will begin working full-time as a PCT at MGH. To be eligible for the program, you must complete a simple reading and math activity so that we can be sure you will be successful in the program. You will receive an email with a link to complete these activities. Each activity is timed. Once you begin, you must complete the whole activity without stopping. Do not click the link to begin until you are ready. You will be given 30 minutes to complete the reading section and 25 minutes to complete the math section. You are not allowed to use any calculators, and you are not allowed to have others help you. Thank you for watching the info session. If you have any questions, please email Jonah St. Clair at JVS.